All right, episode 523 with Dr. Rawls about Lyme disease is going to be brought to you by the PEMF devices from Truly Heal from Marcus Freudenman. He's been on our show a couple times. We got the opportunity to do a workshop with him in Dana Point, California a little while ago and meet him in person and hang out and just enjoy his company. He's an awesome guy. PEMF is pulsed electromagnetic field therapy. And Dr. Rawls mentioned PEMF at the end of the show. And you can use these to dramatically improve the health of your body. And it's a fascinating form of therapy that's now available for people. So we offer what we think are the best machines on the market. So if you go to our site, extremehealthradio.com/523, we'll link to the PEMF devices for you to take a look at. And we're also brought to you by the Relax Far Infrared Sauna. Sauna therapy has been around for thousands of years. We have a great machine that's portable. It's called the Relax Far Infrared Sauna, and it heats up immediately. And we just had a customer write this into us. Robin, she just wrote in the other day, "Thank you, Justin, so much for the heads up on tracking. I received it and love it. Thank you so much," with 3 exclamation points. If it wasn't for you and Kate, I would have never have known about this amazing sauna. I will keep you guys updated on how wonderful it is. You two are providing an amazing service with all you do. Thank you again, and God bless Robin. So the sauna is an awesome machine. I do it every single day for 35 minutes, and it's low EMF. It's just incredible for helping to detox toxins, chemicals, and poisons from your fat cells and improve your lymphatic system. It's an amazing piece of equipment, and it's by far my favorite piece that we have. So if you guys are interested in the sauna or anything else, check them out in our store. So we'll put links to both the PEMF device as well as the sauna at extremehealthradio.com/523. All right. Thank you so much, everybody, for joining us on another episode of Extreme Health Radio. Super excited to be talking with you today. We're going to be talking about Lyme, and Lyme is a big health issue, health concern that people are having these days. And I was just reading something before the show that I think it was in 2012, there was, 30,000 people that were diagnosed, and then that went up to 300,000 in 2013. I don't know if those numbers are correct, but we got Dr. Rawls on the show. We'll be introducing him in just a second. If you guys are interested in the show and want to listen to this particular show on the website, or you want to catch any of the links that we talk about, the show number for this one is going to be extremehealthradio.com/523. Let me make sure I get this correct. Yep, 523. So if you want to go on that page, you can check out any of the links or the books by Dr. Bill Rawls that we'll be talking about today. He is the author of Unlocking Lyme, and as well as the Vital Plan, and another book he wrote a while back called Suffered Long Enough. And he graduated from Bowman Gray School of Medicine at Wake Forest University in 1985. He holds a medical license in North Carolina. And he has his own story with Lyme and fibromyalgia, and he's been doing a lot of work helping people around the world with these particular issues. So if you have Lyme, if your body has Lyme, this would be a good show to listen to or pass on to your friends, anybody that you know that has it. Let me introduce Bill right now. Dr. Rawls, thanks for joining us.
Thank you, Dustin. It's a pleasure to be here.
Are you still in North Carolina?
Absolutely. Yep. It's got to pick one coast or the other, and I like my ocean warm.
I know a lot of people moving out there these days. Is it growing?
Yeah, North Carolina especially. I mean, that's one of the better sides of global warming, I guess, is our climate has improved temperature-wise, and down on the coast, we don't get the extreme heat. But we also are getting milder winters, which is really nice. It's a year-round destination now. Wow,
and you got some nice, beautiful islands off the coast, I think, don't you, too?
Yeah, we're right here at the Outer Banks.
Oh, beautiful, beautiful. So I've heard your work, and I've run across your work, doing 500 plus shows over the course of the last probably 4 years. You just hear about people and I learned about your work probably about 6 months ago, and we put you in our database to contact. And so you have your own story with Lyme and fibromyalgia too that I thought was really interesting because, like you said in one of your shows that I listened to, that a lot of people write about Lyme, but not a lot of people have experienced it and overcome it themselves. So you have a pretty interesting story when it comes to Lyme, don't you?
Yeah, it's odd to say that, but having Lyme disease has almost been a blessing in a way, because having experienced that and struggled through the misery of it and then come out on the other side, my perspective is different than most physicians in the country. And it's given me a whole different perspective on healing and medicine. And frankly, everything you do as a physician, it's been changed.
Now, you started having some symptoms around 45. You, with what you thought, did you think it was anything? Like, what was going through your mind at the time you're having all these symptoms?
Like most people, I didn't know. It was, my whole world was falling apart. And like most everyone that I talk to that has Lyme disease, it's not a tick bite and then an illness that comes right after a tick bite and then never goes away. It's most always a perfect storm of factors surrounding all of that. The illness that people gradually get illness, they become ill from that. I had been taking obstetric call for to every second to third night for about 15 years, and it was catching up with me. I just wasn't sleeping. In my 30s, I could take call, crash, get a good night's sleep, and then do it again the next day. Or just push through. But by late 40s, I wasn't able to do that anymore, and I really lost the ability to sleep. But it wasn't just the sleep. It was fatigue and joint pain and just all these miserable symptoms and just feeling like you had flu continually. And my doctors had no idea what was going on. And, of course, they ran every test known, including the screening test for Lyme, which was negative. And it wasn't until years later that I really abandoned the conventional medical approach that I started to understand my illness and understand how to get over it. Wow.
So is that a common factor that happens, or common instance where people will get a blood test for Lyme and it shows up negative and then they just think they don't have it? Is it easily missable, I guess?
Yeah, and you alluded to the fact that a couple of years ago it's 30,000 and now there's 300,000. And everybody is going, well, we're just, this Lyme thing is just taking over the planet. And my point of view has changed to be the opposite. I think it's always been there. People have always had these weird mystery illnesses, but we haven't known what to attribute it to. So when you look at the testing, all of the current testing, it's designed to to test for acute illness. Someone who's had a tick bite, they become symptomatic, they go into the doctor's office 2 to 4 weeks later, and they have a test. That's not people who have Lyme disease. Most people with Lyme disease have chronic Lyme disease. They don't get an initial infection that's very pronounced. Most people don't remember the tick bite. They don't get sick early on. It's later that they get sick, and it's usually surrounded by these other factors that disrupt immune function that allows this and other microbes to flourish. So most people being tested have chronic Lyme, and that testing is 50-50 at best.
Really?
So we're seeing so many more cases because people are more aware of it, so they are pushing to be tested more often, but even that testing is just scratching the surface of how many people actually are infected with this microbe.
Yeah, it's interesting because I heard on one of your other talks that you did that, a lot of people say that, if you do a Google search and, what causes Lyme, it's always like one bacteria, I forget, Borrelia something, but what you're talking about is, there's a lot of different factors and bacteria that could be causing Lyme, and then also that has to combine with an immune system that's not working and functioning properly too, right?
Correct. Yeah. As our testing will get better, I think probably within the next 10 to 20 years, we'll be able to test for someone's entire microbiome, the sum of all the microbes that are inhabiting their body.
Uh-huh.
And I think what we're going to find is an awful lot of people are carrying Borrelia and many other microbes that are very similar that I call stealth microbes. Mycoplasma, Bartonella, Chlamydia. I mean, there are just scores of them. And a lot of people have them, and they're carrying them, and they don't get sick until something comes along and tips the balance.
That's interesting, because, it sounds to me like the idea that you're talking about is similar to what people will say in the natural health community in regards to like getting the flu or a cold or something, where, you're not going to get it from like a germ or something. It's something that's systemic within you. But then what you're saying is that somehow a tick bite is some sort of a trigger for releasing all of these symptoms. But it's obviously, it has to be, if it's living, like you're saying, in your body altogether beforehand, your body has to be a host for whatever that is prior to the tick bite too, right?
Correct. When you think about it, it's, when you really think about this in logical terms, we're all exposed to these kinds of microbes. Mm-hmm. I mean, you've probably been bitten by a tick or at least a mosquito in your life, right?
Of course, yeah.
Okay, everybody has, and we all get tick bites, we all get mosquito bites, we all get bitten by different kinds of things. We eat food, we drink things that are contaminated through our lifetime. We have intimate contact with other people, and every single one of those things is an opportunity for these particular microbes that we would call host-seeking microbes to join a new host, and that's their objective. So it's so we're all exposed to these kinds of things. I mean, when you look at ticks, to think that you could get bitten by a tick and not have microbes enter your body is really practically absurd. It's every tick carries hundreds of different species of microbes. Every creature on Earth has microbes that they carry. We have about 100 trillion microbes that inhabit our body, several thousand different species. So ticks are nature's perfect vehicle for transmitting microbes. Borrelia is one of many.
Now, is it true in terms of the origin of Lyme that, a lot of the spooky kind of weird stuff people talk about it being created, is that all true, do you think?
No.
No? It's all kind of weird stuff, right? It's like,
yeah, that's kind of weird stuff.
Yeah.
Not to say there aren't odd things that go on in government labs, but a very close relative of the Borrelia that currently is infecting people that we're defining as Lyme disease has been found locked in amber inside a tick from the Dominican Republic that is 15 million years old.
Oh, wow.
So that kind of shoots down the theory. In addition, it was also found in a 5,000-year-old mummy that thawed out of a glacier in the 1990s in the Alps of Italy.
Yeah.
So this thing has been around a while.
Yeah.
What that tells us up front is this isn't a new microbe. We've been dealing with Borrelia for a long, long, long time. Ticks have been biting humans as long as there have been humans, and that's how long Borrelia has been infecting humans.
So what are some of the main, I want to go back to the origin in terms of like how it affects the body and what kind of a body would be a good host for Lyme disease being activated in the body. But I'm curious, what are the symptoms that people typically get? And if they have some of the symptoms, what should they do? Yeah.
Well, symptoms, to answer that question, you have to ask the question, what does a microbe want? The microbe wants a host. These are all host-dependent microbes. They have to have a host to survive. So they must get resources and nutrients from that host to survive. So their strategy is to come on board a new host, adapt to that new host, which changes the microbe, live inside, cultivate resources that they need to survive, and wait until another tick or whatever comes along so they can spread to another host. That's the whole life purpose. That's their mission, all right? So to get that, they have to get past our immune system to get those nutrients that they need. If you look at all the microbes in our body, they all want that same thing. That's what they're there for, all right? But over millions of years, we've developed a very mutual relationship that we allow these other microbes to get some of the nutrients and resources that they need to survive. And the trade-off is they block us from getting other microbes and maybe help with absorption of vitamins and things like that. So we've got a nice symbiotic relationship. These other things that we call stealth microbes, Borrelia, Mycoplasma, Borrelia, Bartonella, and so many others, probably many that we don't really understand yet, they're just on the other side. They're just beyond our normal flora. So our immune system recognizes them, and that's why people don't get sick very much from the beginning. Our immune system immediately recognizes these things. But they're very stealthy. So as soon as they get on board from that tick, they go deep. They clear the bloodstream very, very rapidly, and they penetrate as deeply into tissues as they possibly can. So they disseminate throughout the body very rapidly. How do they do that? They infect white blood cells. Very specifically, they have the ability, all of these stealth microbes have the ability to infect cells. And they infect white blood cells and are carried by the white blood cells to different regions of the body. Once there, they manipulate that white blood cell to produce inflammatory messengers called cytokines that drives more white blood cells into that area, and it generates inflammation, which breaks down tissues, which allows them to get at the resources they need. One of the prime things they want is collagen. So where do you find collagen? Brain, eyes, heart, muscles, joints, skin.
Right.
That's where you find all the symptoms. So it's not as much direct damage by the microbe as it is the microbe manipulating the immune system to generate local inflammation and systemic inflammation. So you have all these weird symptoms, migrating joint pain, eye pain on one side, brain fog, all of this weird stuff happening throughout the body. That is very difficult for doctors to understand. So it's frustrating to doctors and really frustrating to patients.
Yeah, I could see that because you have so many different, so many wide varieties of symptoms that could be sort of applied to other health conditions. And so I can imagine doctors that aren't schooled in Lyme disease or anything like that are just, have no idea where to start. What are the differences between, because you dealt with Lyme and fibromyalgia, is that correct?
Yeah.
Now, is there a big difference? What are the main differences in terms of, when you got rid of your Lyme, did it also help your body to deal with the fibromyalgia or vice versa?
Well, it's our world is built around finding a diagnosis and treating the diagnosis, right?
Right.
So when somebody has lots of these weird symptoms all over, but you can't pinpoint a diagnosis by laboratory evaluation or other diagnostic test, you put them in a category called a disorder, right? So fibromyalgia and chronic fatigue syndrome and many other things that have come along under those name categories are considered disorder. Treatments that are diagnoses that don't really have treatments. You just treat the symptoms because you really don't know what's causing it and you don't know why the patient is ill. But since I've looked at chronic Lyme disease for so long, though, I took on a diagnosis of fibromyalgia in the beginning before I had a positive Lyme test because I didn't know what else it could be. And it's just useful to have something because the doctor has to code something for him to get paid.
Right.
And that's what it boils down to, basically. But when I look at fibromyalgia, chronic fatigue, chronic Lyme disease, all of these chronic conditions now, I basically see the same thing. And it's a function. How someone becomes ill is a function of their genetic makeup. Some people are more susceptible to some things than others. How things come together in their lives to disrupt their immune function, and what kind of microbes that they've picked up along the way in their lifetime. I had probably been carrying Borrelia since I was a child, quite frankly. And it wasn't until I totally disrupted my immune system that I started becoming ill. And that's why it makes it so difficult to diagnose these things. But I also see it as a progression too. Chronic Lyme disease is really a good model for all of chronic illness today. And I think when you look at the autoimmune diseases and MS and all of these things, they are functionally very similar, and we're starting to see associations between various stealth microbes. Borrelia and Parkinson's, they found Borrelia and Alzheimer's plaques. They've found an association between chlamydia and multiple sclerosis and mycoplasma and rheumatoid arthritis. But I don't think it's ever just one microbe. We have this habit in conventional medicine of trying to associate one microbe with one illness. And it's not that way. It's all of these microbes working together, and this dysfunctional immune system, and it's like a pot boiling over. That it's just, and the result is a misery. And so someone with Lyme disease is earlier in the stage. They may progress on to some other more serious illness over time, and typically they do.
That's fascinating. Do you think that, much like, how they haven't done really a lot of studies in terms of the interactions between different pharmaceutical medications, if someone's on 3 and 4 and 5 different medications, and inside each medication, there's probably dozens of different chemicals that make up each medication. So now you've got this sort of exponential issue going on inside people's bodies when they're taking 4 or 5 different kinds of medications. Do you think there's the same kind of issue going on with different bacteria or different viruses, where if there are multiple types of viruses within the body, like we don't even have the cursory understanding yet to understand how these things interact with each other? Do you think?
Oh, yeah, there's no doubt. There's no doubt. Yes, these things do work together. I mean, and that's, when a lot of Lyme physicians talk about biofilms, and what a biofilm is just a collection of microbes working together in the body. And so there's no doubt. I, being a gynecologist, I treated people with cervical precancer for years, and we finally tied human papillomavirus in with that. And I've come around to believing that it's probably not just human papillomavirus, because I've seen so many people with cervical dysplasia, the precancer of the cervix, just not change and just stay that way for years and years and years, because we're following it now, because most people don't progress. And then I've seen people with one exposure that have had a cervical cancer in 6 months.
Wow.
And to me, that says there's something else. And I'm very suspicious of mycoplasma and ureaplasma. And we know that the mycoplasmas, which are a really interesting set of stealth microbes, facilitate the entry of viruses into cells. That's been proven. So, you start putting 2 and 2 together. And to me, there's got to be some other factors. So I think Lyme disease is the same way. I don't think it's an infection just with a microbe. I think all of these things are multiple microbe infections, no doubt about it. But if you're healthy and your immune system stays robust,
you're good.
Fine.
Yeah. So what is the current state of the way doctors understand Lyme these days? If you go to a doctor, do most doctors understand Lyme? Would you go to a specialist? And what would their, is there medication? What are the standard medications people get for Lyme? This
is highly, highly variable.
Okay.
And I think there's a lot of misinformation out there all the way around. Most conventional doctors really don't learn about Lyme disease at all in medical school, and they certainly aren't schooled on these concepts that we've been discussing in the past 20 minutes. They're still going on basically a principle that was defined in the 1800s called Koch's principles, that one microbe causes one illness. And that's true if you look at something like Ebola or malaria, when you're talking about a highly virulent microbe. Most people with Ebola are going to get sick, healthy or not. They're going to become very ill, and the effects are from that one particular microbe. But when you move down to less virulent microbes, these stealth microbe categories, it's a whole different ballgame. And I really don't think many physicians understand it well at all.
Yeah. Well, it's such like we're talking about before, I mean, it's such a bizarre sort of disease with all these different circumstances and different symptoms. I mean, golly, I could understand. I mean, doctors are busy enough, but I mean, that would be very challenging. If I were a doctor, I wouldn't want to have someone come in thinking they have Lyme disease. It's
exactly. Well, it was a difficult patient to see in my office because it's here I knew more about Lyme than anybody, and I wasn't encouraging Lyme people to come to my office because they were so complicated and the system didn't pay for you to spend the time. It was very, very frustrating. Our system is driven by procedures. You do diagnostic procedures to find the diagnosis, and then you do treatment procedures, and that's what you get paid for. You don't really get paid for taking time to talk to people. And it's just a function of the way our healthcare system is. Yeah. I mean, what is the average? Isn't the average amount of time a doctor spends with a patient something like 7-8 minutes or something? That's about all they have, yeah, to make a living. You know what, too? I ended up in a situation where I was trying to do medicine the way it should be. I was seeing about 12 or 15 patients a day, and it was just hard to keep the doors open. Wow. You have to turn over 25 patients in a day or do lots of procedures that you're getting paid for to make a living at all. Wow. 25, you say? 20 to 25, yeah, to really do well, or have nurse practitioners that are turning over a lot of patients for you. Golly, that's amazing. And you know what, too, with today's culture of people being able to research on the internet and the amount of options and choices and information we have today, I would imagine it would be really challenging for docs out there, conventionally trained doctors, to have patients come in that are so complex and complicated, but are relatively well versed as well. And so, you get a patient asking a lot of questions, and, it's got to be hard for docs. For those of us with chronic Lyme disease, the internet has been our savior. Chronic Lyme disease is not a problem that will be solved by doctors or in hospitals. It will be solved by people with chronic Lyme disease who are talking. I mean, the internet goes so much faster than conventional science now. All of that data entered into the internet and people looking at it and sharing information, and that explosion of information is just extraordinary, and that is changing the way things get done. It's really wonderful. I'm really I'm really excited about, there's a lot of issues with the internet, obviously, and, people talking about, being tracked and spied on, or the amount of information or fake news and all this stuff. But I mean, I'm so hopeful, and I'm just so grateful that the amount of information is out there that is, because if you want to find something, you can really do the research and find it. And like you were saying, I mean, people are researching this. They're finding other people who have gone through it. They're finding books. I mean, you could go on Amazon and buy your book, Unlocking Lyme, that probably download it to your Kindle and have it and read it within 20 seconds. It's amazing. That's it. That's when I had to stop doing obstetrics because of my condition. and wasn't able to stay in the practice that I was in because of that. Started a practice that I wanted to create a wellness center, just really not knowing how difficult that was going to be. But I was in a rural area in North Carolina, and when I started the practice, I was somewhat trapped there, so I didn't have the option or the finances to fly around the country and see specialists, and I was really stuck with things that I could get locally and what I could get off the internet and books. And so I poured myself into it, and I had a little bit of an advantage over most people because I did have that medical scientific background that allowed me to better evaluate the good and bad of certain things, possibly better than other people. And I would not be where I am. I would not be living a normal life and helping people with Lyme disease if it had not been for the internet. So I'm hugely grateful, grateful.
Oh gosh, yeah. I mean, to be able to do a show like this, and I know you do different webinars and stuff like that, and other radio shows. I mean, it's awesome what's available today and these days. Do you work with people, if people have Lyme, do you work with them, individually over Skype, or do you do consultations like that?
Usually over phone. I closed my practice. I sold my practice about a year and a half ago to take off a year just to write Unlocking Lyme. Unlocking Lyme was a 3-year book that I crammed into a year because I just felt like it was so important to get the information out there. But we also, I also had the opportunity through the website to start offering consults, and that's been wonderful. I've been talking to people all over the country and actually all over the world. I've helped some people in Europe get their lives back because of my unique perspective. In a 45-minute to hour period, I can put all the pieces together for someone, help them understand their situation better, and move forward. But it's almost more like a health coaching consult in that I am helping them become proactive about their own situation so they can move forward, so they can create that healing environment within their lives and embrace therapies and learn the things that do work and the things that don't work. So that's been nice. But as always, I've always learned from my patients. People teach me things all the time. Just working through situations with people, you learn things. You learn different perspectives. You learn about other people's unique pathways through this whole thing, and that helps you grow. That helps your knowledge base. So I find the consults very, very valuable.
Yeah, I would imagine, because like you just said, I mean, you're learning along the way too. I mean, everyone's different. You're learning what makes someone else hold on to symptoms longer than some other patient of yours. So have you found, what are the success rates, do you think, of natural doctors and Lyme? Like, what do you think that the success rate is there for people if they have Lyme and they want to, kind of heal themselves from that?
That's a really difficult question to answer. And the reason is because I think there are different levels of success in what a person might expect. It's, I am not sure that I've completely cleared Borrelia from my system, or that and I'm sure that I still have some stealth microbes in my system. I'm convinced that most people do. But I have been able to maintain a very helpful immune system and suppress all of the symptoms, and I assume the microbes along with it. So here at age 60, I'm living a very comfortable life. I I don't have the joint pain and back pain and problems that most people my age have. I'm very robust. I just went kite surfing for a couple hours yesterday afternoon.
Oh, wow.
10 years ago, I didn't think I would be able to do that. And it's so I'm living at a very, very high level compared to most average people, even at my age. So even though I don't know whether I've eradicated this microbe from my system, I'm very vigilant. I eat. I'm very careful about my food. I still take herbal therapy on a daily basis, and I do things to keep my immune system robust. But I think everybody should be doing that. As far as cures, people that are going to conventional doctors or Lyme doctors, I don't know. I'm sure there are, but in my practice, I saw an awful lot of people that had squandered all of their savings on IV antibiotics and other therapies that didn't get well.
Wow.
And statistically, if you look at all the studies, there are no studies showing that long-term antibiotic therapy is successful. In fact, there are studies that show the opposite.
Yeah,
so it's hard to gauge. It's hard to gauge because there's so many people out there that aren't specifically being cataloged in the system. It's difficult to know. They'll see a doctor for a while. They may get better for a while. They end up being back at square one. They go to another doctor. That first doctor never knows whether they got well or didn't get well. So it's really hard to know for sure. I do know in the programs that we do that it's we do symptom trackers for a 6-month period, and we're seeing progressive improvement on herbal therapy and lifestyle modifications and things like that. So I know that people are getting a positive result, but I think you have to be vigilant for a long time to get where you want to be.
Yeah, that makes sense. I mean, a lot of the doctors that we've had on our show have talked about, that statistic that says that I think the average person will have, I think it's 2, 3, or 4 bouts with cancer in their life and not even know it or be diagnosed. And, and how we're always creating cancer cells within our body, but it's our immune system that sort of keeps everything, at bay. And so it sounds like it's probably the same thing with the Lyme is, like you said, probably you and I, have these bacteria, but somehow our immune system, by taking care of ourselves and all of that on a daily basis, is what's keeping us feeling normal. That makes sense.
As I said, I now see chronic Lyme disease as a model for all other illness. It's truly, no matter what illness you look at, you can start tracing it back to the things that disrupt immune function in the first place. And I think these stealth microbes have a much bigger role to play in chronic illness of every variety than is presently being recognized. And you can think of it as more of a microbiome imbalance. We all start with a pretty clean microbiome when we're born that we pick up from our mother and our surrounding environment. And then as you go through life, then you pick up all of these other things as you go along, and what kind of microbes you pick up and what kind of factors come together to disrupt immune function is important. So you look at that early microbiome and you ask that question, well, what are vaccines and all of these things that we're doing? How is that affecting our microbiome and antibiotics used in children at high levels? What is this doing to our microbiome and the biological makeup of things as we progress through time, and how does that affect how we think, how we breathe, how we function?
Yeah, it's fascinating because everything really is. I mean, even our own thoughts are causing, could cause our immune systems to be weakened, and so there's obviously so many different factors. I'm curious about, there's 2 different sort of classes of people, those that are experiencing some of the symptoms related to Lyme, and then there are those that maybe have Lyme but don't feel any of the symptoms, like maybe the majority of the people in the United States or around the world, because not everyone feels the symptoms of Lyme. So in terms of the class of people that maybe have Lyme and don't feel any symptoms, there's nothing going on, they feel great, they feel healthy. Obviously, the immune system is going to be very important for them to make sure they keep a strong and healthy immune system to prevent any of the Lyme, the spirochetes and all these sort of bacteria from surfacing. But then you have the people that do feel the symptoms of Lyme, like you did when you were 45, and these people are classically diagnosed as having Lyme. So with those people, obviously the immune system is going to be a big part of overcoming Lyme. Is it possible for that group of people to be able to solely focus on their immune system to overturn the symptoms related to Lyme, or do they have to have that going on in the background along with other herbs and different protocols to quote unquote kill these bacteria?
Yeah, it's I think that's a good question, and this is one concept that I think is more important to get out there than probably anything that I'm talking about. When I look at therapies for things, I split it up into three categories: restorative therapies, symptomatic therapies, and heroic therapies. And these are just names that I use. They're not technical names. They're just functional names. Restorative therapies are things that enhance immune function. A good diet, regular exercise, herbal therapy is the cornerstone of restorative therapies. That's probably more important than anything else in any kind of illness, except for like a very acute illness, like if you broke your leg. Symptomatic therapies are things that basically block symptoms. You take an antidepressant to get rid of depression. Does it treat the depression and make it go away? No, it just covers up the symptom of it. And then heroic therapies would be that really aggressive, disrupt the disease process, slam the microbes. So antibiotics, for Lyme, ozone, acute treatment for a heart attack, a broken leg. Those are very heroic therapies. And if you look at our system, all we use is heroic and symptomatic therapies. That entire restorative base is just ignored. So I put it in perspective with a pyramid. You could divide the pyramid up into thirds. The bottom, that big base, is restorative. The second level is symptomatic, but the idea is if you're doing a good job with the restorative, you gradually eliminate the need for the symptoms because the symptoms gradually go away. But early on, that can be valuable. And then heroic, when nothing else is really working. So when you look at that concept, it's very, very powerful, and that's what I'm trying to do with the book, with the consults that I do, is help people understand the role that they play in creating that restorative base. Again, the cornerstone of that is herbal therapy. Herbal therapy is doing a lot, you were asking about how we treat these microbes, or do we just treat the immune system? You do both. And I think you've got to pick the right treatment for the right thing. When you look at synthetic antibiotics, they're designed for microbes that are very consolidated in the body and that are growing fast. In other words, something like an acute pneumonia. In acute pneumonia, the microbes are consolidated in one area of the lungs. They're growing very, very rapidly. They're very aggressive. And so you put somebody in the hospital and a few days of IV antibiotics, they turn the corner and they're doing fine. Unless their immune system isn't working. If you've got a person that's very elderly, it doesn't matter how much antibiotics you give them, it's not going to overcome that infection. So even those antibiotics are just knocking things down enough for the immune system to get back on its feet and take over. So no matter what you're talking about, the immune system is key. But with an acute pneumonia, if I suggested that we wanted to use herbs to treat that, that would be negligence. That would be malpractice. Now, you take these stealth microbes that are dispersed throughout the body. They're in very low concentrations. They're growing very slowly. All right. Pneumococcal bacteria will turn over a generation in 20 minutes. Borrelia, that causes Lyme disease, about 12 hours.
Wow.
So they're not growing much faster or really any faster than our normal flora. So in many ways, they're acting like normal flora, except they're not confined to the places that normal flora are. So they're growing very slowly. They live inside cells. They're in low concentrations in the body. The symptoms are not coming from this overwhelming infection of the microbes. Mm-hmm. It's coming from manipulation of the immune system. That's what's making people sick. So there's not an overwhelming infection. This is why they're so hard to find, and antibiotics just don't work. So the solution is, well, we need to treat people for months and months and months on end with multiple antibiotics. What you do in that case is, I tell people, when you start antibiotics for Lyme disease, you enter a race, or start antibiotics for any infection. You enter a race. Are you going to wipe out the offending microbe before you totally disrupt your normal flora and suppress immune function even further? Pneumonia, you're probably going to win the race. Lyme disease, it's unlikely, because months and months on end of antibiotics, you're going to disrupt normal flora and select out pathogens and cause more problems. So that makes herbal therapy a really attractive solution for dealing with this problem. When you look at herbs are from plants. Every plant is having to make a biochemical smorgasbord of chemicals to protect itself from microbes of every variety. It's not one chemical like a synthetic antibiotic. It's a whole spectrum of chemicals. It's lots of stuff. And it's not just against bacteria. It's against viruses and yeast and protozoa and bacteria. So it's more suppressive, and it's perfect for these stealth microbes that we have. So when you look at herbal therapy, you're having the effect of suppressing the microbes. You're making it more difficult for the microbes to function, but you're probably not killing them outright as like you would with an antibiotic. Because of that, it doesn't have this adverse effect on the normal flora of the body. So people can take herbs. I've been taking herbal therapy for 10 years, and I have never, and when I started out, I couldn't get 2 weeks through a course of antibiotics before I would be sick.
All right.
So you've got the suppressive effect, but a lot of your herbs are also immune modulators. What does that mean? That means that they're reducing these inflammatory cytokines. They're taking away the ability of these microbes to break down tissues. And that allows the immune system to get back on its feet and start targeting these things and putting them back in the corral where they don't do harm. So herbal therapy is really a fantastic solution for this whole thing. So
would herbal therapy be more what you're talking about in terms of the foundation, the immune system foundation?
I think it's really important, and it's a very important part of that restorative base. You know, what we do in conventional medicine when we address a problem is we look for the most potent thing we can find to deal with that problem. And always, that's also the most toxic thing. You look at all of our drug therapies and all of our therapies, there's a high potential for harm there. So you start with the things that make sense. Start with the things that have a low potential for harm that might have a lot of benefit. That herbal therapy is one of those things. Changing someone's diet, exercise, all of those things, the potential for harm is virtually zero. The potential for harm with herbal therapy is extraordinarily low.
The only problem with herbal therapy, though, is in terms of just the way Americans are sort of conditioned, is that they want a pill for every ill and they want quick results, you know? And so that's one of the issues is sort of retraining people's brain to say this is a long-term thing. And, you know what I mean? It's a long game approach, really.
That's why working with chronic Lyme has been so satisfying and fibromyalgia too, because it's a population of people that have been discarded by the medical establishment. They've been marginalized, and they found that they have to do it themselves. And everybody wants something that will just fix them. I mean, I did. If I could just have taken a pill and been well, yes, I want to go on with my life. I'm sick of this. But you really learn after a while that it's just not going to happen. You have to be proactive. It's a battle that's won with patience and persistence. And chronic Lyme patients, a large percentage of them come around to that. So yeah, if it means taking herbs every day, twice a day, or 3 times a day, and gradually climbing out of that hole, I tell people, set yourself a 4-year plan. Where do you want to be in 4 years? Do you want to be jumping from one thing to another that's not going to work? Or do you want to go ahead and start working now so you're better a year from now and even better in 4 years, that you get your life back and you stay that way instead of constantly chasing a rainbow?
Yeah, I think it's cool because if you take the long game approach, like you were saying, 4 years, I mean, you're educating yourself along the way. You're experimenting with different herbs. You're feeling how things are affecting your body. You're really learning a lot by experience, and probably a lot through just mental learning and reading and listening and stuff. And so it becomes like, after 4 years, not only do you have, better symptoms, lesser symptoms, but you're also super highly educated. And so it really becomes a transformation of the whole person too at that time.
That's it. It's people who overcome Lyme disease are special people. They have skills that other people don't have. They are able to go about life differently than most people. They are more than what they started to be. And it's really cool to watch that.
Yeah, it's so awesome. And, a lot of people with chronic issues, like you're saying, I don't remember, everything bleeds together. I listen to so many different things. I'm not sure if you and I talked about this at the beginning or if it was one of your other talks. But, gosh, what was I going to say? Something about, I just lost my train of thought, but it was something about, becoming a different person in the process. And I just think that, there's a lot of people out there that have chronic issues. Maybe it's not Lyme, but it's, working on a cancer growth or working on something else. And, if they really start taking their health in their own hands and learning, I mean, the information available to people today is just so massive. And, it's just so, I mean, at the same time, there being a lot of great information, there's also a lot of misleading information too. So you have to really kind of wade through that. But man, there's never been a better time to really have an issue like Lyme or any other disease, really.
No, it's true. Yeah. Having Lyme 20 years ago, first of all, you wouldn't have known it. You would have just been sick. My grandfather was a general practitioner, back in the 30s through the 60s, and I can remember when I was a child going on house calls with him, and they were just sickly people, and nobody really knew why they were sick. They were just sick, and he would help them in whatever he could with that acute symptom relief, but really didn't have much to offer as far as actually making people well, of restoring their health. Now we know more than we've ever known, and that information is widely available on the internet. This time of awareness that we're going through is extraordinary, and people can get their lives back, and that's wonderful. It is a great time. For sure.
Have you noticed?
There's a lot of hope.
Oh gosh, it's awesome in that respect. Have you noticed any sort of correlation with emotion or spirituality? Because we talk a lot about that on this show. A lot of different guests will talk about the traumatic, emotional issues that may happen in someone's life that may come back around again and trigger a disease to come forth. Or have you noticed anything like that with regards to Lyme's?
Oh, there's no doubt. The emotional aspect is huge. It's just that depression of spirit and depression of emotion that we all go through, just dealing with the modern world and dealing with the situations around us, are huge immune system disruptors. Probably the biggest.
Wow.
And yeah, that's one of the first things that I look for. When I'm counseling patients, I do it differently than I learned in medical school. Medical school, you talk to the patient, you get their symptoms, and you move forward to try to find the diagnosis, so you find which drug or whatever to treat it with.
Mm-hmm.
I go backwards now. I start looking for the scene of the crime. What factors came together that made that person ill, and how can we reverse those factors to put them on a course of wellness, to put them in a positive direction instead of dwelling in the misery. Mm-hmm. Because so much of conventional medicine, we practice managed illness, not wellness. Mm-hmm. And I think it's so yes, that emotional, spiritual component is so remarkably important. Mm-hmm. And again, it's something that people have to find outside the medical system now.
Yeah, because when you are dealing with a pill for every ill, or even an herb for every ill, that may be sort of across the board what could help most people, but each person has their own individual issues and dramas and emotional upheavals in their life and sickness and things. And so, those are going to be different for every person. So mapping that out, you can't map, that to a drug or map that to an herb. I mean, that's separate from all of this stuff, isn't it?
No, absolutely. Yes, it's part of the process, and it has to be a part of the entire healing process for the person to get well.
Right. Now, what were your three? I'm thinking of the pyramid again. You have the immune system down at the bottom, and then you have the symptomatic ways of dealing with something. And then what was the third one?
Restorative therapies makes that base, and that's lifestyle and dietary modifications. And I consider herbal therapy part of that. Okay. There are probably other things too. Acupuncture would probably be part of that. That's helping to restore the ability of the immune system to function. It's reducing stress. It's increasing endorphins. Infrared sauna, pulsed electromagnetic therapy. There are a lot of things that would go under that category that aren't that have a really low potential for harm. But it's boosting the immune system. It's restoring the healing systems of the body instead of trying to fix the illness. And then symptomatic is second. There are some natural things there. Cannabis and cannabidiol, CBD from cannabis, is probably a better way to handle symptoms. I don't think it's a cure for Lyme disease, but it's better than narcotics and other drugs. But as the person goes through time, the symptoms do gradually get better. So those things are less needed. And then the heroic therapies, sometimes in certain situations, people do need a course of antibiotics, or there may be value in ozone or hyperbaric oxygen or some type of therapy that's more abrupt, but there's always a price to pay.
Yeah, interesting. So, yeah, I'm glad that you touched on each of those things. What other things can you think of in terms of heroic?
Those are the main things. For Lyme disease, antibiotic therapies, and probably the top of my list that actually works, that has any value, is ozone. I think there's a lot of promise there. If you had asked me that 3 or 4 years ago, I would have said no, but there is more scientific literature that's been coming out, and just patient interactions that are documented on the internet that are positive. But what I'm finding is people that do that exclusively, it helps for a little while, and then they're right back where they started. So if you're doing those kinds of therapies without that restorative base, you're just not going to get well, or it's unlikely.
Yeah, that makes sense.
Rice machines, some of their electrical therapies, I don't think have been well studied, but there could be some merit there. It's just we don't know enough about them. I don't think we're using them to their full potential at all. So those are the main things. Those are the top of the list things.
Yeah, I was going to ask you about Rife. Yeah, because a lot of people have sort of correlated the Rife technology along with Lyme disease. Wasn't that the origination of how Rife started? Was Royal Rife going after Lyme disease? Is that what was going on?
No, he was going for cancer.
Oh, Okay.
Yeah, and that's where this guy, very intuitively, he saw a connection between hidden microbes that were not well defined in that time period and cancer. And for most of his work, though, was in a petri dish, and it wasn't correlated well with human specimens. So the Rife machines now are battery powered. They're not very powerful. And frankly, we just haven't done enough research. I did pull a study that was done in the past year that they did have something like a Rife machine, that they were actually seeing some benefit in cancer patients. So I think the potential is there. But I think what will happen is, though, as we increase the power of it, there's going to be more damage. There's going to be a higher potential for damage. So I still put Rife in the category of heroic therapies, though. So it's hard to say. Some people get benefits, some people don't. Really poorly defined at this time.
Are you familiar with? There's a guy by the name of Dr. His name is escaping me. Dr. Trevor Marshall. Are you familiar with his work down in Australia at all?
Yes, I am.
What do you think about his whole vitamin D thing and the autoimmune thing? What do you think about all that stuff?
I read about it and studied it. It was a treatment for sarcoid, which those patients have found to have exceedingly high vitamin D levels. I think it's microbial. I'm not sure which microbe. They did get some benefit using a drug to suppress. It's actually a common heart drug, hypertension drug, and they use it in really high doses to suppress vitamin D.
Right.
And I can't put together the logic of it. The way I function is on a very logical basis, and I can't figure out the logic behind why it would work at this point. And I've done so well personally with herbal therapies and seen so many people do well with herbal therapies. I just, maybe there's something there, but I just am not sure at this point.
Yeah, it's really an interesting idea. And somehow in his research, he's saying that vitamin D is a immune system suppressant. And so people with Lyme disease should not be taking excess amounts of vitamin D. And then he's got this whole theory about autoimmune disease is really not autoimmune disease. There's no such thing as that. I mean, he's really kind of a controversial guy, but I haven't really looked too much into his work other than there's a lady that we're trying to get on the show. I think she may have had Lyme. I don't know. Amy Parole, something like that. And yeah, it's just interesting. A lot of people out there doing lots of different types of work, and
sure,
it's piecing it all together, isn't it, for the person?
Yeah, I think it's always everybody's looking for the one thing that's going to fix it. And my experience, and I think this is going to be proven to be true over and over, is it's not the one big thing with Lyme disease. It's lots and lots of little things done persistently over time. And there may be some merit to the vitamin D. I think the biggest thing it illustrates is we really don't understand vitamins very well and what they do in the body. It's much more complex. We don't understand vitamin D or how to test for it well. And it's so just as many people are saying that vitamin D is essential for optimal immune function, and most Lyme patients we're seeing and most chronic illness patients we're seeing have a severely depressed vitamin D level and respond to vitamin D supplements. So that one I just haven't quite figured out yet.
It's really challenging for me. I'm sorry to cut you off. It's really challenging for me because you have people that do some really interesting work, and then you have someone like we had a guest on a while back who was talking about the dangers of fish oil, and he was going on and on about fish oil and how it's toxic and it's pharmacological overdose of I forget if it's omega-3 or 6, and he was just saying there would be no way that we would ever be able to eat that much fish, and then you got to worry about toxicity, and he just was going on. But then you hear conventional alternative, because alternative is kind of, its own group, but alternative medicine practitioners, and the majority of them will say fish oil is great, or you'll have 99% of people say that vitamin D helps to upregulate your immune system and is responsible for 3,000 metabolic processes in the body, and it's so critical for your health. Then you have one guy saying it's really bad, and it's just, they sound convincing, but it's hard to really wrap your mind around all this stuff,
I think the thing that has stood me so well through my time as a physician is that I've always had to rely on common sense and how things fit together. And I've always been one to look at as much information as there is available. Whenever you look at any problem, it's like a huge jigsaw puzzle. And as you put pieces down on the table, you start to see that picture. But you never have the whole picture, so you have to make inferences. Mm-hmm. And common sense is where you make your inferences. And so often what we have in our conventional medical world in medical science is everybody's looking at the pieces individually and not trying to find the picture. Mm-hmm. Or they're taking one piece and they're making huge inferences. Same thing with the fish oil thing. He's correct. We haven't been giving people fish oil supplements in the levels that we have been doing recently, mm-hmm. In recent years. So there's a little bit of an unknown there. We haven't been giving people vitamin C for more than about 50 years. That's what's so nice about the herbs is people have been using herbs for thousands of years. We know more about those than anything on earth. But you look at the fish oil thing, where that came from, where we're getting our information is not from clinical studies, but from population studies. And if you want to answer that question, how does omega-3 affect cardiovascular disease, you go to places where they eat lots and lots and lots of fish, or they traditionally have. Japan and native Inuit populations. So if you look at the Japanese who are eating huge amounts of fish and native Inuits who are eating seal and blubber that are loaded with omega-3s, their cardiovascular disease is extraordinarily low. Mm. So they do have the levels of omega-3s that we're targeting with supplements. So that's where that information comes from. And generally, you look at the Japanese and Inuit populations and those populations that are naturally doing that, they have a very low incidence of most diseases. Mm. So you make an inference to say, why is that? And fish oil looks like it's very likely. Mm-hmm. So you take it to the lab and you look at it at a biochemical level, and you see that these omega-3s do have some really positive attributes. But there's still that slight question of, is it the same if you're taking a bunch of pills every day compared to taking the oil from the fish itself, from eating 6 cans of sardines every day? Mm. So we don't always know all the answers, but we try to put together as much of that puzzle as we can and make practical solutions, and we keep reevaluating over and over again. Mm-hmm. And that's part of it. Yeah,
it's fascinating. So you have a lot of stuff on vitalplan.com, and we'll put a link to all your different websites, unlockinglyme.com and rawlsmd.com, on this show page. People just want to remember extremehealthradio.com/523. I'll put a bunch of links to his websites. But over on vitalplan.com, it looks like, you work with people outside of Lyme and fibromyalgia. You do lots of other just general health work with people. Is that correct?
Yeah, that we found that all of these concepts are important to people. So we have found a number of different ways of getting that information out to a variety of different people. The Lyme disease community is very special to me just because of my unique experience, and I feel like I have a lot to say to that group of people. Mm-hmm. So they're important, but I think anybody could benefit from these concepts. And
And what kind of herbs do you take? I'm sure you do sort of daily stuff, and then you probably a few times a year do different cleansing or different types of protocols. What kinds of stuff do you take every day, and what form do you like? Do you like the powders or the tinctures, or what kind of stuff do you like?
Yeah, it's well, there are a lot of forms, and I do take a lot of herbs. Getting well, I was taking just handfuls of capsules a day, and I was learning about it. A lot of times, the supplements you see that are herbs. Many herbalists would say, well, you need to grow it in your backyard and grow it yourself and process it yourself. But that's just really not practical to get the levels that we're talking about. So if you do a whole herb, it's basically the powdered herb. So it's got a lot of fiber in it. Mm-hmm. So to get more out of the herb, you want to do an extract. So there are different kinds of extracts. Water alcohol is the traditional that's going to pull some of the fat-based and all of the water-based chemicals from the herb. And that way you exclude you strain out all the fiber from the stems and leaves and everything. So all you end up with is this really highly concentrated tincture of alcohol and water. Mm-hmm. The problem with that, and what I ran into when I was trying to do the level of therapy that I was doing, was I was probably getting a jigger and alcohol a day.
I was just going to say, right.
These things are 50% alcohol, and you do 2 or 3 droppers full out of 6 or 8 supplements.
That's a lot.
And that's a lot of alcohol.
Yeah.
So we tend to use the powdered extracts, which basically they take that water alcohol extract, they spray it out on the surface, dry off all of the water and alcohol, and condense it into a powder.
Wow.
So it's highly concentrated, so you can condense a lot more of it. Fewer capsules, basically, nice. Easier to take. So I'm taking mainly powdered extracts just because they're easy, and you don't get a lot of alcohol from them.
What are your main top herbs that you like these days?
Whoa, gee. I mean, there's so many.
There's too many, right? You want to take them all every day.
I mean, I'm constantly trying new things. Our standard protocol for Lyme, we use andrographis and cat's claw and sarsaparilla, and I like a stabilized bacillin from a garlic product. Japanese knotweed is another one. Those are the main antimicrobials, and then immune modulators. Your mushrooms, shelf mushrooms, especially reishi, cordyceps are my favorites. Others are chaga, lion's mane. Those are the things that have those immune modulating properties. They have some antimicrobial properties too. Mm-hmm. Chinese skullcap. But the cool thing about modern herbalism is you're not restricted to one tradition. So it's kind of, we're using the best of the best from all of the traditions, and you can get wonderful, high-grade, very pure extracts from all over the world. So you have access to things from Chinese medicine and Ayurvedic medicine from India and from the Amazon. A favorite herb from the Amazon is anamu. Mm-hmm. And there are just so many great herbs worldwide, and even some growing in your backyard, because all plants are making these chemicals, and there's so many things out there that do mesh well with human biochemistry that aren't poisons, that have a medicinal effect. We've been using them so long that we know a lot about this stuff. Mm-hmm. So it's really cool.
Yeah, it's really cool how we can really just get herbs from around the world, like you said, because a lot, hundreds or thousands of years ago, if you're in China, you would just do TCM as your basic sort of foundation. But now we have access to herbs from all over the world. It's so cool. You can kind of combine these two. And I wonder if there's been a lot of work done in terms of combining Ayurvedic and South American and Chinese and different herbs.
It's happening, and I call it modern herbalism, and there are many pioneers of modern herbalism out there, but it's really cool that instead of the old way of, well, you've got this symptom, here's the herb you take to get rid of that symptom, we're looking herbs now at how they affect the healing systems of the body and internal microbes and the immune system. So we're using them very differently. So we're respecting that historic use, but then looking at the biochemistry of the herb and how it affects human physiology, so you can pull herbs from different traditions that have particular properties that might be desirable to enhance that wellness platform that you want to build. And it's really exciting to look at herbalism that way, and the availability of herbs. You know, that is true. I mean, you look at it historically, for someone to use herbal therapy, they were restricted to the local herbs and the local knowledge, because most people didn't have knowledge of herbs. So historically, the availability wasn't anywhere close to what it is now. Herbs are more available and more of a powerful healing force than anything on the planet. There's just no doubt.
And what I like about some of what the Chinese will say, they'll talk about superior and inferior herbs, and they have this idea that, you know, if an herb is superior or inferior, it just means that, you know, an inferior herb would be an herb that they would call more, you know, a powerful herb to get rid of a symptom, but you should have never let yourself get to that place to begin with. And that's why you want to take the inferior herbs as just a lifestyle, cooking with them, taking them every day, working with them, and all kinds of stuff. It's cool.
Sure. Yeah. I call them normalizers and effectors. Those are my words that I use. Normalizing herbs are things that restore healing systems in the body, balanced hormone systems, you know, and modulate immune functions. And generally those herbs really have a low potential for side effects. And then there are effectors, things like St. John's wort that acts very much like the drugs that are serotonin reuptake inhibitors. Does basically the same thing as a drug. It has a direct target effect. Valerian and kava have a very targeted effect that would be very similar to a drug like Valium. And all of your drugs are effectors. So when you look at the type of herbal therapy that I use, I'm using mostly normalizers with very few effectors, or the effectors that I'm using are very mild effectors. So the potential for harm is very low. And I don't really use St. John's wort very much. I don't use valerian or kava very much. And frankly, I haven't found the place. You know, sometimes if I need an effect like that, I'll actually go to a drug or recommend a drug, because sometimes the drug is a little cleaner than the herb is. So it's so I really like my normalizing herbs. They're really, really good.
Yeah, me too. I love working with herbs. I've been doing some more working with herbs this past fall and winter. It's just, I'm making a tincture right now from reishi.
Cool.
I got some organic, gosh, I forget what kind of alcohol, but it was hard to find. It was hard to find organic alcohol that didn't have gluten, but I did a bunch of tea with shaga, and I'm loving that. And then after I boiled the shaga about, I think maybe 5 different batches, and then I put it in some alcohol, and now I've done that since January. So now I've got, come fall, I'm going to have a really good batch of shaga tincture.
Chaga is nice. It's got some really nice, again, all of the mushrooms have very similar properties, but chaga is nice because it tastes good.
I know, I love it.
That tea is really nice. Yep, it's a good one.
It's a good one. So what would you suggest, just wrapping up here, if someone has Lyme, I should say their body has Lyme, and they want to learn more about you and your work and what you have to offer. It's interesting. I was just reading something the other day that people typically, before they will make a purchase online or work with someone online, they'll consume, I think, 6 or 7 different pieces of content over the course of a few months before they actually pull the trigger now and buy something, which is cool because we can give out so much great information like we're doing. But what would you suggest someone do? Learn more about your website, read your book, and then move on from there?
Yeah, the book is a good place to start. I mean, that's a minimal investment, and someone could take that book alone and really know everything they need to know to put together a protocol for restoring Lyme, for overcoming Lyme, or fibromyalgia, or really anything in those categories. They're going to understand the disease process and what's behind it, and how it has to be treated differently than some other diseases would be. It gives the protocols for the herbs. I put an appendix in the back that's just loaded with alternative herbs. And, my goal with any of our programs is to turn people on to herbalism, for them to understand how powerful these things are and how wonderful they are. So I like to help people build that foundation of knowledge and then be able to go and to move out from there. So my hope is that people will read the book or use our programs and they'll move from there to embrace a lifestyle that includes herbs and these other facets of wellness that are so important.
And then if they need to, they can contact you and maybe work with you personally over Skype or the phone or something like that.
Yeah, absolutely. I would recommend reading the book first, though, because there's so much information there. And if someone reads the book first, then I'm way ahead of the game, and I can take their situation and put it together faster for them. And a lot of people, they won't even need me after they read the book. It'll start to click, and everything will start to become clear. Wow,
that's awesome. Wow, well, thanks, Doc, for spending a good hour and a half or hour and 15 minutes with us.
Well, thank you, Justin. It's been a pleasure, truly.
Yeah, hang on the line there really quick. I'm just going to close out the show. Thanks, everyone, for joining us. We really appreciate it. I hope you guys got some really good information from this show. Like I was saying at the beginning, I mean, at 300,000 people, those are just the people that have been, traditionally diagnosed with Lyme, and I'm sure there's a lot more. So that's a huge chunk and a huge percentage of the population dealing with Lyme. So if you feel like that's you, make sure to check out this show, pass the show on to a friend. Dr. Rawls and I would appreciate that. And that it would help your friend. It would be good for everybody. The show number for this particular show is extremehealthradio.com/523. I'll be back after the break and do a little breakdown and talk more about Lyme and these types of situations. So, thanks for joining us. We love you guys. Let us know if we can ever help, and we'll catch you guys on the next episode.
In the 1950s, Dr. Joanna Budwig had a 90% success rate curing people of cancer using fresh-pressed flax oil and cottage cheese. The combination of dairy protein with unoxidized flax oil was able to restore oxygen transfer. It is now well known the cells of our bodies require unoxidized omega-3 and 6 seed oils to both attract and absorb oxygen. For the first time, there are seed oils with virtually zero oxidation, even after 1 year at room temperature. All other, quote, cold-pressed seed oils are structurally damaged and significantly oxidized by the time you consume them. Andrea's seed oils retain the correct shape, electron content, and information that is quickly communicated to all the cells of your body. By taking these sacred seed oils, your whole body will begin to use oxygen as the Creator designed it. Now combine this with our Life Force Enhanced One World Whey protein, and you have a winning combination to confer energy and health like never before. Click on the 5-seed oil banner right here on extremehealthradio.com. That's extremehealthradio.com.
All right. Well, there you go. We just wrapped up with Dr. Bill Rawls. I hope you guys enjoyed that show. I was talking to him. I'm not sure if I mentioned this on the air or if this was before we started recording. I don't know if we've done any shows on Lyme disease before. We were going to reach out to Stephen Harold Buhner about Lyme, and we've had a lot of requests from people asking us to do a show on Lyme. And it was interesting because our guests, they sort of schedule their own shows. We send them a link and they can pick from some available time slots that we have for them. And it's funny, we've just now recently, over the past probably 2 weeks, had, oh my gosh, like probably 15 different requests for Lyme. And it was just, and then I looked at who's, scheduled for today, and it was, Dr. Bill Rawls. So maybe this is all in divine timing. Let me go in on our website and see, if you hover over, find a show on the site. You know what? I'm going to do Extreme Health Radio into Google, Lyme. I don't know if we've ever tackled Lyme disease. That's crazy. Oh, well, yeah, we did. We talked with Dr. Kevin Connors. That was episode 360. We did a show 166 with Chris Kaler. He does more energy medicine and things like that. That's about it on Lyme. That's crazy. I mean, 300,000 people. I can't believe that we haven't done any shows on Lyme. I mean, that's amazing. But 300,000 people diagnosed, like I was just saying. And, Man, that's a lot of people. That is a lot of people. And I like what he was saying about building your immune system. I don't have his book, but it would be interesting. Let me just read over his book. He's got, let's see. On his book cover, it says, "My greatest credential as a physician treating Lyme disease is that I've lived it. I've experienced virtually every symptom of Lyme disease, and in the process learned exactly what it took to overcome it." Dr. Bill Rawls, MD. I didn't even ask him about his medical license and if he's had any issues, having and maintaining that medical license. A lot of people these days are getting their licenses taken away or choosing to walk away and work as a naturopathic doctor and not being under the umbrella of the modern medical system. But in his book, he's got part 1. He's got 30 chapters in his book, so I won't read all the chapters, but I'll just read a couple of the first ones. First chapter, or part 1, is called Understanding Chronic Lyme Disease. Chapter 1 is Lyme Disease and Borrelia. Chapter 2 is After the Bite. Chapter 3 is Borrelia, I can't even say this, burgdorferi? Burgdorferi? I'm not sure. Chapter 4, Why Virulence Matters. Chapter 5, Chronic Immune Dysfunction. Part 2, Gathering Information, and then he talks about the Lyme tests and the quest for diagnosis, self-assessments, laboratory evaluations, testing for microbes. So he's got a whole approach with Lyme disease, herbal medicine. So he's got some cool stuff. Low dose, yeah, that's what it was. Low dose naltrexone. That was the pharmaceutical drug that doctor, what was his name? Dr. Trevor Marshall. You look up the Marshall Protocol. He was the guy down in Australia that was talking about vitamin D, and there's no such thing as autoimmune disease. Interesting ideas. It's one of those things where, with all of this stuff, like we mentioned on the show, we really have to become our own health detectives. And I think that the first place for us to start is self-assessment, self-awareness, and then learning. I just started listening to the Healthy Gut Summit. Is that what it's called? I forget. The Healthy Gut Summit or Healthy Colon Summit. I forget what it was. We offer all these summits. If you're signed up to our newsletter list, you get, every time there's a free summit, I let you guys know in the email. And, I highly recommend, if you're on our newsletter list, check those summits out because, I've gotten so much great information from summits, and they really do dive much deeper into these subjects because they have, 30 people talking about one subject. So you're going to get a lot of different experiential knowledge, a lot of different, theory and research that are being done by all these people. So, these summits are invaluable, in my opinion, because you really get to go deep and study these types of things. But I was just listening to one about digestion and just learning so much. We've done 23 shows. And this only accounts for, I probably listen to alternative health radio shows and podcasts, from 2003 all the way up until, let's say, podcasting wasn't even a thing back in 2003, but I would download stuff off the internet, and all the way up until, just recently, a couple years, or just, recently, and I've probably listened to tens of thousands, maybe even hundreds of thousands of hours of podcasts and radio shows about, alternative health. And, it really is an empowering thing when you start learning about your choices and your options. And you really do have things that you think you've tried everything, but there are people out there doing research and putting into practice, in their own practice, protocols and ideas and testings that, you've never heard about, because if you haven't been up on the research, then you're not going to hear all this stuff. And so that's why I think the summits are just awesome. Right now, let me see, there's, the Microbiome Summit just ended. That one just ended. There's the Hay House World Summit. I love those ones. Those ones are really cool because they're kind of have a lot to do with success and mindset and spirituality and personal development. And they also throw in some health stuff in there as well. But they have some really good stuff on the Hay House World Summit. And then there's I think there's a Lyme Summit. Actually, there is a Lyme Summit coming up very soon. Let me see here. Let me go to, there's a place on my computer where I keep a list of all the summits if you guys are interested, let me get the link for you. 2017 Summit schedule. Microbiome went from May 18th or May 8th to the 15th. So, okay, so that's ending today. And then, let's see, where are we? May 8th to 15th. And then then we have the Lyme Summit, June 29th to June 26th. So you know what? I will put a note on this page. Add Lyme Summit to notes. Okay, so I will put the link to the Lyme Summit that's coming again. It will be June 19th through June 26th, 2017. So if you're listening to this in the future, then you might have missed it. But June 19th to the 26th, Lyme Summit, Chronic Lyme Summit 2. So I'll put a link to that. I do want to mention too, there are some of the products that he mentioned, or some of the substances or things that he's mentioned, Dr. Rawls, on the show as the heroic part of his protocols and stuff. There's a CBD CBD tincture that I'm really, really proud to offer to you guys, and it's from a friend of ours, Larry Ostrowski, over at Be Well Buzz, and he's got a product called Soul CBD, and it's amazing. I'll put a link to it on this page so you can take a look at that and learn more about it. You know what I'll do? I'll link it over to our store, because in our store we have a bunch of, with all the products in our store, we add videos, so it's not just a place to see the products or to buy them, but you can get, some really good knowledge and information and sort of research and learn more about the product. So we put videos about all the products. So I'll put a link to the CBD as well as the PEMF that we offer through Marcus Freudenman from Truly Heal. And I'll put a link to that, as well as I'll put a link to the sauna. We sell the Relax Far Infrared Sauna and the ozone machine as well. That's from our buddy Marcus over at Truly Heal. And you can sign up, and for the PEMF and the ozone, you can learn more about those. If you click over, he's got a free course that you can learn. I think he sends you some videos, and you can learn all about what PEMF is, what ozone is, and how it affects the body. But again, like what Dr. Rawls was saying, it's so super, super important to understand that, you can't just, like, let's say, for example, I can't make any claims here. You can't claim anything. But let's say, just say, for example, PEMF, had the ability to knock out Lyme in the body, right? But since Lyme is such a chronic, systemic disease that involves a weakened immune system, like Dr. Rawls was saying, you can't throw something like PEMF. PEMF might work if you're doing everything else correctly. Or CBD might work if you're doing everything else correctly. So everything else is, getting enough sleep, getting some vitamin D, I think. I'm not convinced about Dr. Trevor Marshall down in Australia. I'm not sold on his theory, but who knows? But getting vitamin D, getting outside, getting sunshine, eating healthy, not eating things that are going to be damaging you, doing your meditation, doing your prayers, doing your Qigong, doing yoga, getting really in touch with, letting things go, doing some emotional, spiritual work and letting things go and not judging people, and just dialing in your whole protocol of your life and what you do on a daily basis. And like he said, I think that the emotional, spiritual part, I think that's the number one. I think that's the foundation of everything that we should have as part of our daily, how we live our lives. And so, it's really, really important to get all that stuff dialed in. So then once you start doing all that stuff, then you can start incorporating some of his herbs. You have this sort of foundational stuff going on in the background. Then you can start doing herbs, tinctures. You can either make them yourself or buy them from anywhere online. Dr. Rawls, you can buy them from, other outfitters too. Get some high quality herbs and supplements. And then you can start doing some of the heroic stuff like the Rife machine or the PEMF and that kind of stuff. And, building a whole sort of lifestyle that fits in with supporting your body's ability to heal. Because really, ultimately, what your body wants to do is to heal. That's what your body wants to do. It's always, in every moment, in every second of every day, it's trying to create and to find a new homeostasis. It's just that what happens is that we go through the stresses of life, or we have negative thoughts, or we have a traumatic event that occurs, or we have stress at work, and we have these dramas and, everything taking our energy from us that lowers our immune system. And so your body's constantly compensating for that. Your body is working all the time to get to that level. It's sort of like the pH of your blood. Your blood pH has to be within a specific, I think Dr. Marshall, who we had on the show out of Texas, says it's got to be anywhere from 6.4 to 7.0. Tissue pH and organ pH and stuff, that's a different thing, but the blood has to be within a specific range. And so it's just like this with your immune system and with your overall health. There's not a lot of give. And so your body's constantly working hard to maintain a homeostasis, which is our birthright, which is abundant and vibrant health, really. And so because our body's working so hard to constantly heal, we're always working against our body. And so when you start doing some of these foundational principles of eating right, taking your enzymes, taking your supplements, food combining properly, being grateful, breathing, getting out in the sun, doing your exercises, all this stuff you can do easy. It doesn't take a lot of time each day. But once you start working with your body instead of against your body, you have the foundation there where some of these heroic protocols have a much better chance of working, in my opinion. So, all right. So that's that. I hope you guys enjoyed that show. Let's see if there's anything else. I wanted to tell you guys too, one of the other things that we're going to be doing here pretty soon, we're working behind the scenes. It's such a massive undertaking and project that we're working on, but it's going to be, we've got two things going on that I want to let you know about. One, I can kind of divulge and tell you a lot about it. The other one, I can't tell you too much about, but it's going to be free, and it's going to be starting in, I think, April. Wait, what was this? It's June, July. It's going to be starting July of 2017. But the one that I can talk about that's, it's not free. It's a paid membership community that we're going to be starting soon. And we're really excited about this because, we talk a lot of theory on this site, and we talk a lot of the why, but not a lot of the how and the practical information. And so we're going to be launching the Extreme Health Academy. We're targeting August of 2017. So if you're listening after that, it should be available. There's so much work that's going into this thing, and as a result of that, we've had to cut back some of our shows. So what we've had to do is go from 3 shows a week to 2 shows a week, and in order to build this whole thing. So this whole thing is going to be awesome because I'm super excited about it, because it's going to be a repository. It's going to be exhaustive work that I'm putting together with different people who are going to be developing products and courses for you guys, and we're going to be working with high-level people tackling different issues with people. So we are in the process of filtering out who we want to work with for specific courses, and we're going to be doing everything from digestion to anti-aging. We're going to be taking listener questions, so you'll be able to get your questions answered. We're going to be doing courses on every separate organ of the body, so that's going to be really cool to be able to, let's say you've got some liver issues, or let's say you have a history of liver disease in your family, and you just want to know some really practical information about how to take care of your liver and the best ways to do that. Well, that's all going to be there. And so we're super excited about that. I'm really, really, really looking forward to doing this. I also wanted to create a place too where we can have quick access to short form information. Like, let's say you got acid reflux or you got heartburn. What do you do? How do you find information really quick? We're going to be building all of this stuff in there. So this is going to be something that we're going to be working on and adding new content, new courses, live Q&A calls potentially once a month where you can get your questions answered, and all kinds of new information that we're going to be adding. There's also going to be a forum in there where we could all communicate together and share inspiration and share protocols and really, really, really help each other out. And so that's all happening pretty soon. So as a result of that, it's a massive, huge project. It's not going to be for everybody. It's going to be a paid monthly thing, but in my opinion, it's going to be the most practical and the best membership site community in the world, and I'm really excited about it. I'm super, super excited to be able to offer this. It's just something for me. It's like something I want for me, because I think about, I am the person who is the listener. I'm just like you guys. I want to know, how do I put all this into practice? And one of the other things I want to do is work with a series of different doctors, and we're going to be having 4 cleanses per year. And we're going to be doing the same cleanses every single year, but every year maybe we'll have a different doctor oversee a particular cleanse, and then we'll have different cleanse types. So like, let's say every spring you do a colon cleanse. Well, we'll do different colon cleanses, but every spring it will be the colon. And we're going to develop a whole program of that. Something else that I'm working on and I'm really interested in doing is developing a course called Health Through the Decades, where if you're a man or a woman, you can pick which decade you're in, from 20s to 30s, 30s to 40s. And we're going to go into all the things that you need to look out for, your blood markers, your supplements, things you need to avoid, things you need to make sure you do. So during each decade of your life, you're getting healthier and healthier, not getting sicker and sicker. And so that's going to be, we got so many things that we want to do. So I'm really excited about it. So if you're interested in that, what I'll do is I'll put a link to the page. Let's see, Extreme Health Academy. Health Academy. I'll put a link to it on this page, which is extremehealthradio.com/523. So all you have to remember is the number is 523 for this show, and I'll put a link to that as well. The other thing, too, is I'll put a link to the survey. I really need your guys' help if you can. There's about 10 questions. It takes literally about 30 seconds. And I'd love to know what your biggest health challenges are. I'd love to know what's your biggest issue, where and what courses you would like. And you just click a button and there's a series of questions you can answer. And we're going to be tackling, the things that get the highest percentage, we're going to be tackling those first. And so it's your opportunity to let me know what you guys want. And that way we can work together and build something super cool. I'm really looking forward to it. So we'll put the survey on this page too if you guys are interested in checking that out. The other thing that's happening in, what is it now? It's, what's this, May? This is May, as I'm recording this, May 15th, 2017. This is going to be in July. It's somewhat related to the Academy, but this is free and it's going to be for everybody. I'm really looking forward to this. Kate and I have been working on this behind the scenes as well. So much going on behind the scenes. We haven't done a lot of shows lately, as you guys know, but I'm really trying to get this thing done as well. And it's going to be, I'll give you a hint. Let's see. Should I give you a hint? It's going to be a year-long. It's going to be a year-long endeavor for people. And it's going to be free. And so that's all the hint that I'll give you. But I'm really looking forward to that too, because it's something that we can all sort of work together and improving our health together in like a social media kind of a community. So that's going to be fun. So all that to say, thank you guys. We love you. Thanks for being on the show, for listening, passing it on to your friends. Lots going on behind the scenes here. Thanks for bearing with us for the shows, not being so many of them, but we appreciate it. And we love you. Let us know if we can ever help. We'll catch you guys on the next episode. Thanks for passing this show on to your friends. Oh, also, thanks for your support in our store. Thanks for your Patreon support. Those of you that support us on Patreon, you guys are awesome. Patreon is a website where you can go and donate like $1 a month or something like that. Or you can do that on PayPal as well. There's links for that on the right side of our website. But thank you guys. You guys are so cool. I appreciate you guys so much. And also thank you guys for buying through our Amazon link. A lot of you guys don't know that you can support the show by buying through our link on Amazon. And so you don't even have to buy anything health related, which is really cool. So if you guys want to support us, if you like the work that we do but don't have any extra money to give us $1 a month or anything like that, Amazon is a great way. So what you can do is go to extremehealthradio.com. On the right-hand side, there's an Amazon banner. And just below that, there's some text that says something to the effect of, click here and drag me to your desktop. So you hold your click down, you drag that text onto your desktop of your computer, Mac or PC, and then it creates a little icon on your computer. So this way, you don't have to remember to go to our site every time you want to make an Amazon purchase. Just double-click that icon on your computer. You can rename it like Extreme Health Radio or something, and that helps support the show. That's an awesome way to do it. And if you guys make regular purchases on Amazon, it helps us a lot. So we appreciate that so much. It's a huge way that we help support ourselves. We use the money that we make from the show, to buy our dog food, to buy our own food, to pay our rent, to pay our office rent, our studio that we have. And so your support is super, super greatly appreciated. So hope you guys got some good information from Dr. Rawls. We might have him on the show again. I would love to do that. I really liked him a lot. He's doing some cool things. So, again, thank you guys. You rock. We love you, and we'll catch you guys on the next episode.
No material on this blog is intended to suggest that you should not seek professional medical care. Always work with qualified medical professionals, even if you educate yourself in the field of live food, nutrition, and alternative medicine. I'm not a doctor, nor am I offering readers medical advice of any kind. None of the information offered here should be interpreted as a diagnosis of any disease, nor an attempt to treat or